right. Gabapentin is an anti-epileptic, so it helps prevent seizures. Um, You want to watch for signs of depression and monitor seizures to see if it's being effective. You want to use your seizure protocol, so you do not want to have we'll go over that in a minute. The side effects are somnolence, dizziness, so that's just somnolence, that's where they're sleeping more, dizziness, ataxia, they're not able to walk, fatigue, peripheral edema, and that usually will diminish with use. You want to avoid driving or other hazardous activities until the patient knows that they're not going to be impaired, because it could make them really sleepy. Okay, so the story. A patient is given gabapentin to prevent seizures, in which you will need to make sure the bed is low, no restraints or restrictive clothing in case they have a seizure. If the medicine is given for pain, monitor how the pain is helping. Make sure you're not just asking them how to rate their pain, but what type of pain it is, and always check for mood changes, depression, and suicidal thoughts. Patients should be advised not to drive or operate heavy machinery until they know how the medicine will affect them. Dizziness, ataxia, fatigue are all side effects, but they usually diminish with time. Okay, now we're going to get into the opioids. Okay, so sublimase, which fentanyl. Okay, it's a strong opioid analgesic, so it's going to be used to treat pain and control breakthrough pains in patients taking other opioids. If the patch is used, make sure you're rotating the site, keeping the area clean, and you're not leaving on more than one patch at a time. Now, this is an opioid. So if you go into fatal respiratory depression, we need to reverse that with naloxone. Okay, side effects, of course, respiratory depression, sedation, constipation, urinary retention, and nausea. It is about 100 times more potent than morphine, so you need to be really careful. Okay, here's the story. This is sublimase. Sublimase fentanyl. This medicine changes the way the body views pains. It can be used as an analgesic, so in anesthesia. Check your blood pressure before giving the medication. Not anesthesia, I'm sorry, Crick. It can be used as pain medication. But check your blood pressure before giving it. It can cause respiratory depression and constipation and nausea. If it causes fatal respiratory depression, it can be reduced by an opioid antagonist and the naloxone, which causes, it can stop, not the naloxone, but sublimase can cause apnea and bradycardia. And don't take it with grapefruit juice. Do not take with grapefruit juice. Assess their pain, their respiratory rate, their pulse, and if they're nonverbal, you can still watch their facial expression. It's given a lot after a major trauma. Hydromorphine, it's another opioid antagonist. It's a pain reliever, and it's indicated in moderate or severe pain. It's an opioid, so you're checking the respiration rate, pulse, blood pressure before giving it and while on the medication. You're diluting it with normal saline when you're giving it, and you're giving it really slow to avoid the CNS depression. It can be reversed with naloxone. It can cause respiratory depression, sedation, cough suppression, and your normal GI stuff, and urinary retention. Here's the story. A patient comes in with severe pain. Hydromorphone is given. You're going to check the respiratory rate, the pulse, the blood pressure to make sure they're in normal range before giving the drug, and make sure you have naloxone on hand. The drug needs to be diluted with equal parts of normal saline and is injected very slowly to avoid CNS depression. Monitor CNS depression by taking vital signs, watching the patient. The patient may be dizzy and will need help standing up and stabilizing by dangling their feet over the side of the bed before standing. Another opioid is morphine sulfate. Okay, so morphine sulfate. This is also used for moderate to severe pain. You're going to check the respirations and pulse and blood pressure before giving it. Once again, the antidote is naloxone. It can cause sleepiness, sedation, respiratory depression, constipation, and you need to watch how they get up. Same with the other. Okay, so an opioid antagonist is the one that's going to take all of those effects away from an opioid overdose, and that is naloxone. It is um, so the thing about it is it doesn't have really any side effects. So if you're not sure if they had an opioid, if they're not breathing because of an opioid or something else, you can give it to them because it's not going to hurt them if it's not. It just won't work if it's not an opioid. Um, Now, it can take them straight from not breathing to a state of high alertness, so you need to be careful because I've heard that patients come up swinging. You also need to be aware that the half-life on this stuff is shorter than the opioid, so it's going to wear off before the opioid does, so they could go back into a toxic state and need more of the naloxone. See, it's better to give it in small doses rather than one large dose. If a baby is born and the mom was given the anesthesia or had this opioid in her system, the baby can also get naloxone. It's safe for babies. It can be given to caregivers to take home and somebody that's a chronic user, and in that case, it's a nasal spray or an auto injector, kind of like an EpiPen. It's given to reverse an opioid crash. Medication has very few side effects but will wear off quicker than an opioid, so be ready for subsequent doses. Patients could come up swinging because it works very quickly. It isn't, if they're not suffering from the opioid overdose, it doesn't matter because it's not going to hurt them, and it can be given to babies. Okay, so this one is, sorry, hold on one second. So levothyroxine is a thyroid. So look for that THYR in the middle. It treats hypothyroidism. So if your thyroid isn't producing enough and your levels are low regardless of the cause, so it could be from a thyroid surgery, from getting radiation treatment, or from an anti-thyroid drug, whatever the case, if your thyroid level is low, you can take levothyroxine. Levothyroxine patients should separate the admin of these drugs by 4 hours. The serum, THS is an important means of evaluation, so you want to be monitoring that, and you don't want to interrupt or discontinue the results just because you're seeing positive results. You want to keep going with the medication. It rarely causes any adverse effects, but it should be taken on an empty stomach in the morning, at least 30 to 60 minutes before breakfast to avoid problems with absorption. It takes about a month to get your correct levels built up in the plasma, so it has an onset of full effects is delayed. Now, you could have an acute overdose of thyrotoxicis, which results in the symptoms of that are tachycardia, chest pain, tremors, nervousness, insomnia, hyperthermia, heat intolerance, and sweating. A chronic overdose is accelerated bone loss and increased risk of atrial fibrillation, especially in older adults. I don't have an antidote for that, but I do see that those are the symptoms for the overdosage. Okay, so now let's switch to the anti-diabetic. So if an anti-diabetic, maybe this is going to be used to treat type 2 diabetes, and it's called metformin. You want to watch out for lackadasiosis and renal failure. The side effects, GI, of course, it could decrease your B12, that metal taste again, metal taste in your mouth, and dehydration. This medication is given to a patient who has type 2 diabetes because it's used to lower their blood sugar and let the patient know they are experiencing a metallic taste while they're on the medication, or develop a headache. Decreased B12 has also been experienced. You may experience this as the medication lowers your blood sugar. Okay, so let's look at a nitrate. You're having chest pains, think you're having a heart attack, they're going to give you nitrates, nitroglycerin. Okay, this is going to decrease the pain of it, and it's also going to increase the oxygen supply, but it does not decrease the demand. It is a vasodilator. So it's going to dilate. You're going to get more supply because more blood's going to go through, but it does not reduce the demand of what is needed. It treats hypertension and mobilizing edema associated with mild to moderate heart failure or hepatic or renal disease. So it's absorbed very easily. So you can take it all kinds of ways. Sublingual, you can put it under your tongue, you can put it in your cheek. It has a patch, there's a pill. It can go in an IV. The half-life is 5 to 7 minutes. So most of the dose is destroyed before it goes through the liver. I'm almost sure this is the one you can give like 3 times in 15 minutes. The tolerance to the drug can develop quickly, so you want to give the lowest effective dosages or add beta blockers or calcium channel blockers to the regimen. You can withhold it for a little bit to try to give it where it can be effective. Very important. You see that all the time on some movies, like don't give it with Viagra. And they're like, oh no, I haven't taken Viagra. And they're like, it'll kill you. Oh yeah, I did. It's in a dark bottle, so it shouldn't come in contact with light or heat. There is hypotension, so it's going to drop your blood pressure. It's going to make your heart rate go up. You could have orthostatic hypotension. You're going to want to watch for lightheadedness and dizziness. It can increase your heart rate and oxygen demand. Remember, because it increases the supply, but it doesn't reduce the demand. So you could have facial flushing because all that blood is rushing up. It's got to get to you. Okay. The headache is usually severe, but it's going to decrease over the first few weeks of treatment. It can be reduced by taking aspirin, acetaminophen, or other mild analgesics. It reduces the frequency and intensity of heart attacks. You have to use in caution if the patient is already hypotensive, and in patients that use drugs that lower their blood pressure anyway, including alcohol or antihypertensive meds. You can give it under the tongue, and it's going to cause a tingling. That means it's working, and it also can cause a headache because all that blood is rushing to your head, and that's very common. So let's say a patient is experiencing chest pains. You want to check the vitals. The upper one needs to be above 90 to ensure that it isn't using sildenafil or similar meds like Viagra. You cannot use, so it's sildenafil, fill at the end, you're filling, you know what? And it can cause to unsafe drops of blood pressure, and which could cause you to die. You want to protect the meds from sunlight because it comes in a dark bottle. You should not get it on the healthcare skills worker because you're going to experience the same effects. It shouldn't be given with somebody that already has intracranial pressure. Watch for dizziness and lightheadedness and hypotension, tachycardia, or effects. Tolerance develops quickly. Monitor pain and can be given 3 times like every 5 minutes. Okay, protein pump inhibitors are our next one. So you are going to take that like if you have GERD. So you have all that heartburn. It's going to reduce your gastric secretions. It may cause you to have some diarrhea, headache, dizziness. It can increase your chance of pneumonia, and it also may pose a long-term risk of the decrease of B12 absorption, which could give you, I don't know if you could or if this is separate, but osteoporosis, and which could lead to fractures. It keeps your body from making acid in the final step. You don't want to take it if you're pregnant or breastfeeding, and ritonavir can cause toxic levels. So if you're taking that as well, you want to stay away from that. Patients experience heartburn and GERD. This medication stops the acid production, and it can cause a chance of pneumonia. It can also decrease your B12 levels and your bone fractures. Now, statins. What is a statin going to do? You hear that all the time. So it's going to lower your bad cholesterol. It lowers your LDL and total cholesterol. Now, this statin is like this miracle drug because it treats basically everything, and you can use it for Alzheimer's, kidney disease, MS, macular degeneration, glaucoma, rheumatoid arthritis, weak and brittle bones. You name it, you can use it. The uncommon effects are a headache, a rash, memory loss, or GI disturbances. Now, the only one bad thing, so usually it doesn't cause anything, but if it causes something, an extremely rare is rhamdombilitis and myopathy, so basically something that happens in your muscles. So if you start to get unexplained muscle pain, you want to let your doctors know about that. The good thing about this medicine, it raises your good cholesterol, it decreases plaque, and lowers the bad. It improves the outcomes in lowering your risk of heart attack, MI, and sudden death. So your patient's veins and arteries can be blocked because of all this cholesterol. So the medication lowers the bad, increases the good. You want to monitor the liver levels, though. You want to take it at nighttime because cholesterol is made at night. So at night, this drug can do its job. You can take it with food, but not a good drug for people with liver disease. Somvastin, so there's two. There's the atorvastatin and the